excited about the panel here. We had a couple prep sessions. We've got a lot to share. And I think very excited about the topic, that partnerships and how do you create success through partnerships in a very complicated healthcare system. And knowing that no matter what size company, in my background in Blue Health Intelligence, we are owned by 17 Blue Cross plans, so we get the special privilege of working with all the Blue plans and creating partnerships. A relatively small company or a really large company. I got to work with Kathy at CVS Health, one of the largest Fortune 5 companies, but every place requires strong partnerships to really create success. And you'll hear a lot of perspectives today. So really excited about our panelists and really sharing ideas as sort of what makes a successful partnership, things about different dimensions, internal, external technology, and really sort of hearing about the case studies of lessons learned in creating successful partnerships. So we'll start with introductions, and have our panelists introduce themselves and really talk just a little bit about what partnerships mean to them and in their organization. Kathy?
Sure. So I'm Kathy Filkins, Chief Operating Officer of Active Health. Active Health is a CVS company. We are a health technology company that powers population health solutions. We sell into the payer-agnostic market, which means that our clients or buyers are other payers. They are large employers, state and local governments, unions, and so that's the focus we have from a company. We were founded based on clinical analytics was our DNA, so worked a lot with Bob on terms of analytics and data, but we have grown that portfolio to include a broad set of products and capabilities that are focused on not only digital engagement, but one-on-one coaching, group coaching, utilization management, and really focused on a broad set of population health. In terms of partnership, and I know we'll talk about this a little bit more, but as you can imagine, being a standalone company within CVS, partnership is key to our success. So that is both from an internal perspective. From an external perspective, we're partnering with other payers. Typically, we're bundling our products with their products, which requires a lot of delicate partnership in terms of not only how do we go to market from a client and a member management perspective, but even from a technology perspective, how do we make sure that our products and solutions are creating a seamless experience for their members? And I think the other piece is looking at partners that are technology partners. We do have within my organization design, build, run of our products, but I want to make sure that my teams and the capital dollars that we have are spent on building capabilities that differentiate us. And so we're partnering with a lot of different technology companies, both from a build and a run perspective, so that we can leverage their R&D, and I don't have to do all that myself. So that's another side of partnership that we're really focused on.
Fantastic. Rita?
Hi, I'm Rita Sharma. I am the Chief Product Officer of Pager Plus on Life. I've been in healthcare and technology my entire career. Most recently, I was at Salesforce and created a product called Health Cloud, focused on patient relationship management, and is used in lots of sectors today. Pager and On Life primarily is virtual care and wellness, and our customers are typically plans, health plans. And a big part of all my growth strategy is always around partnership. So regardless of what organization I've been part of, it has been pretty foundational to everything we do, whether it's technology partnerships, customer partnerships are hugely important, and then tech partnerships in the way of ecosystem. So I think we'll get into some of the details of that, but it's very important, and that's why I'm so looking forward to this discussion today.
JR.
Yeah, thank you, Bob. I'm JR Allen, Vice President of Accelerated Technologies at HCA. HCA, we're based here in Nashville. We have around 180 hospitals, a little over. I usually get smiles when I try to have to explain what HCA does. But for those who don't know, we've also got about 2,000 ambulatory sites, physicians' offices, ambulatory surgery centers, urgent care clinics. Hopefully you don't have to visit either of the last two while you're spending your time here in Nashville this week. And within that space, I lead a technology team that builds products for our clinical and operational spaces within that broad ecosphere of HCA. So I can run the gamut on some of the things we've heard about today, from use of AI to real-time analytics to building out data to power those different products. And so that is our focus. Within that, we have to have partnerships, internal, external. We'll touch on a lot of those. Internal is actually about just as important as external. On the external side, that involves both technology partners that help develop technology as well as those that provide products or platforms for us, which we'll get into more later.
Fantastic. So maybe to kick things off, start with, you share your experience on the life cycle of partnerships. How do you, going from definition to building to governing to measuring success, how has that worked? And maybe talk a little bit of example in your organization from your past. And particularly, what's the hardest part? Like, if you had to get one thing right, what's the thing to start from here and then figure out all the rest of it out? Rita, you want to start?
Sure. So I think the life cycle depends on the type of partnership. So if it's a technology partnership, so I think of Validic as a partner for us, which really accelerated our time to market, especially around remote patient monitoring, which is something we needed to do for our customers. And it behooved us to really partner with Validic, again, to get ourselves to market very quickly. So we had to define the use case, the workflows, and then say, okay, what is the best product? Do we build it or do we partner? In this case, we chose to partner. With customers, it's very different in terms of really plugging into their innovation cycles, into their strategies, into their issues. So we partner very closely with Florida Blue, a big customer for us, and they've been pretty critical to helping us define the problem set for them and their strategy in terms of where they're looking to go in the future. And then we say, okay, how do we provide solutions for that? And then we measure that. And measurement to me is, did we reach member satisfaction? Did we reach outcomes? Did we reach the type of results that that customer wanted? So for our partnerships with customers, hugely important for that innovation cycle.
And Rita, when you think about that, so you're on both sides. So your technology partnership, you want to help get to market faster. Mm-hmm. So that's where you have to make the decision whether to just buy or partner. And with your customers, you're trying to usually want to be a partner to them. Yeah. How do you make that decision of sort of when do you become to build versus buying versus partnering? Is there really a difference?
I do think on the build and partner side, on the technology side, it's really about speed to market, right? Yep. Getting innovation to market. What we want to do is deliver the most powerful platform and experience from a member perspective, and for our customers, for their customers, right? And so that decision around build versus buy in that scenario ends up being how quickly can we get this innovation to market in service of what our customers are trying to do, right? And that's really how the evaluation around build versus buy goes from a technology perspective.
Sure.
How quickly can we get it to market?
Got it.
Yeah.
You know, I think that can actually evolve over time. Thinking through that reminded me of an example where within HCA, we were wanting to optimize use of ventilators. And this was in 2019. It became a lot more serious in 2020. And so, you know, when you think about your partners, you want to look at what is your entire value chain. And that's whether it's process-oriented, you know, people and services, like if we look at value-based healthcare, or if it's just your technology chain. What does it take to build a product and deploy that out? And so we had begun to build a product to monitor data from vents, but it was typed in manually. So we wanted to integrate directly with vents itself. And our manufacturers were more than happy to give us the data from those if we paid a lot of money. And when we looked at what it would cost for HCA, it was about $5,000 per vent, $40 million just to get raw data from vents. And that's not feasible. You know, HCA's big, but that's not feasible. Yeah. And so we began, you know, meeting with different potential partners to look at it. And it stood out one cloud partner that I don't think is in the room because I see a few great friends from Google in the front row. It was not that group. We're selling kind of the infrastructure, but what we needed was just to get the data. And during that presentation, I realized they had a little device that would get the data. And I said, well, what's that from? And they said, well, it's just a partner. I said, but where'd they get it? And tracked it down. And he said, well, you know, you can build those as commodity. So we ended up partnering with a company to build our own hardware devices to get this data off. And whereas it was $5,000 before, we got it to about a little under $100 per machine. But that is not what we're in the business of. So that just enabled us to get past that first hurdle. Then we realized, well, the hardware isn't the only problem. There's all these drivers that you have to integrate with, and you have to build. So now we're working with another partner that will take that on. We've proven, look, you can do it with cheap hardware, and now they will take that on, deliver that as a product for us. And so we end up not being anywhere in it in the end, just the recipient of the data, but working through a partner at a time enabled us to figure out what is that entire value chain.
So it sounds like, one, that's got to be a great ROI on that,
Yeah.
from 40 million to 5,000 to 100, but also sort of figuring out how do you sort of extend your skills and find people who can get stuff there a lot faster than just building it yourself.
That's right. That's right.
Fantastic. Kath, anything you'd add?
I will say that one thing I think in terms of being a partner, and that's both with my technology partners and then with the clients that I partner with, we just had a situation today where, we have our sales team that's out there talking to clients and came to us and said, hey, I've got this great opportunity. And it was a great opportunity, but to be willing to say no. Like, this would be someone who I would like to partner with. This would be a good client for us to have, but we're not going to be successful. And I think going into partnerships, whether it's an internal partner, a technology partner, or a customer that you're selling to we're not always willing. I was at IBM before I came to CVS, and I always respected clients who were very upfront with me, who said, I could say to them, I don't think these capabilities are going to meet your needs. I think we need to look for another partner for you, or I think people respect that. So I think that being honest and transparent, both in terms of who you're partnering with and the expectations you have with your technology partners, I think has been very helpful, not only for your own personal reputation, but to make sure that you're going to be successful. And I think that that's a key piece.
And it's so easy to say no to your sales team, isn't it?
I'll tell you, some of my team is here, so they know how far up the chain. But from a clinical operations, it wasn't going to be the right solution. From a technology under my team and from a product perspective, it just wasn't the right thing. And we just have to be willing to say, I want my client to be successful, but I also want us to be successful. And sometimes that means that you have to say no.
That's right.
I always tell customers, yes and no are the answers you want. You don't want the maybe. Nobody wants the call where they're like, oh, well, we'll have to go back and think about it and touch base with, the team, and then we'll let you know. Like, it's yes or no it's a much better answer.
That's right.
Yeah.
Do you ever see that sometimes a simple answer of, we don't want a full-on partnership, but let's just start with a simple transaction and build from there. So don't keep it less complicated. Sometimes partner is executive teams, investment on both sides, but sometimes that's a really hard place to start.
Yeah.
Has that ever occurred in your world?
Yeah, so I think, for example, we have a partner that we're using to help, and it's a partner that I think potentially we're both using, to help with some of the things that we're doing. So we started with, here's the problem that we have, and it was a very technology problem. We needed a product to do X. I didn't want to spend the time on X. And then that business grew so that we were using it in multiple products. And now we're actually talking to them as a go-to-market together, because we have a set of capabilities that they don't have, so they can bring us to their customers, as well as us bringing them to more of our customers within the product solution. So we see it kind of growing over time in terms of how we partner. And once again, that's based on successful experience with them, looking at our roadmaps, getting more, I think, going from that vendor relationship to the partner, where you're actually looking at your roadmaps, making joint decisions together about design and strategy, which can be really beneficial. But we also can't have lots of those kinds of partners because it takes time and effort to manage them. So we have to be very selective in terms of which ones we're going to kind of do that co-branding with and co-marketing with, because it's cost and effort on both sides.
Yep. Do you find, in the life cycle, do you always start with the success metrics? Do you always know what you're getting into, or sometimes it's, we'll figure out when we get there?
So I think with customers, and I think the stage of where Pager is at right now, Pager plus On Life, I do think we have to come at it always as a partner, right? Because we're in a mode of learning and growing, and so we want to align as closely to the success metrics from our customer's perspective, and then focus on the innovation, on how do we bring that to market as quickly as possible. So I think it really depends on the cycle. When I was at Salesforce, obviously when we got far into the development of the product, it was a little more of a vendor type of relationship that we were having with our partners and also with our customers. But I would say at Pager plus On Life, it is very much around how do we really deeply partner and be very clear with our use case and understand the intent of our customers, and then bring those innovations to market as quickly as possible, not just for the use of that given customer, but across the ecosystem, so that it can benefit lots of our customers.
Yeah, I think in the end, all of these relationships, you want to turn into a partnership, whatever you call it in the beginning. And one area that's, I'll say it's intriguing, is, as many in here know, within the healthcare industry, there's this fascinating relationship between payers and providers. And, neither of us exist without the other. So some might call it a necessary partnership, but it can be challenging sometimes. And I look at it as two people who are sent to a dance together, and they've got to dance together, but they both want to lead. And maybe one wants to do the Charleston and the other the Macarena. And so they're just, we know we're here, we want to have a good time, but this is hard to do. But it's very necessary. And the better that works, the better it is for all of us, for all of our patients, because ultimately what we're looking for is harmony in healthcare. It's just really hard to get to when it's different, clanging voices at the same time. And so in that context, there have been several teams of us at HCA who throughout this year have been meeting with some of our largest payers. And we've started, and we have a digital summit with each of them. And we start by painting a vision which is like grandmother and apple pie, which everybody would want. We call it frictionless care. And it's the idea that there is a place and a system and time at which all of the rules and the ways that we want to operate together are in agreement, and these systems can check the information that we're sharing. But we know that's a really long shot, and it's a long way off. And so we begin with that vision, but then we break down into what can we do today that will help each of us? And in fact, we've had 2 of these so far. In each case, it's things that are very basic to begin with. So for example, the first was, can we add some more capacity to an existing API to send more data to you? Because it slows some things down, and that's pretty easy. But it's one step that we've accomplished together. And that's the way you can build it up in that type of relationship. So in the end, you get to a much more confident partnership, but it can take a while to get there.
Yeah, it certainly makes sense. And I've certainly experienced it's critical to get the high level alignment. What are we trying to achieve sort of from the organizational perspective? That's sometimes some things, partnerships fail there. But it's getting to the initial success metrics. Like, how are we going to know we're on the right track in a feedback loop? That's where I think most things go from let's go after the grand vision. But if you don't break it down into sort of what are the first steps and how we're going to measure them, that's where I think a lot of them sort of still stay at the very vague level. And you look back in a year, you really haven't accomplished very much. But often you wouldn't have spent a lot of time on it either. We talked, some of the things that are brought up around payer-provider partnerships, technology partnerships, customers. What about internal partnerships? Particularly if you've ever worked at a large organization, we know this well, that's as critical a partnership as external. Is that use the same mentality? Are they harder or easier? Sort of, Kathy, we could probably have some war stories we could swap. Positive war stories. If that's
I think in many respects, they're actually harder, I think, internal partnerships. And I say that because you don't have as much, I'm going to use the word leverage, and it might not be the right word, but if I'm dealing with a partner who is a vendor, and I am working with that, they're providing me a technology, I can say, I don't want to use your technology anymore, I'm going to use this other one's technology. But if I'm within an enterprise and I am reliant on using that enterprise, considered an infrastructure asset, or they're required to do certain IT work on certain capabilities that I need, I don't have as much leverage to say I'm going to go do something else. So I have to make that partnership work, and I have to have ambassadors, is what we call it as part of our business strategy this year. Who are my ambassadors? CVS is an extremely large company, and I think a previous panelist was talking about, we have not only do we have multiple lines of business, commercial, Medicare, Medicaid, but we have multiple companies. And so you need people who are listening in their meetings to advocate for you and your products. And so I think building that network of ambassadors who speak up for your products and capabilities, I think is key to be successful internally, because otherwise you won't be able to keep your eye on the ball in terms of decisions that are being made or capital dollars that are going to be invested, and how can you leverage those. So I don't know, I feel internal partnerships sometimes are a little bit harder than external ones.
Yeah, I think certain partnerships internally are super critical, like the engineering relationship. Very important, and I'm not just saying that because we're here with Emids. But I think when I think about our internal partnerships, we have clinicians on staff And so our goal always is to make sure that the clinicians are operating at the top of their license. So partnering with them, understanding their problems, how quickly we can get them through their interactions and their encounters. So it was very critical to build some kind of an intake bot, which is what we did. And we did this in partnership with Informatica. So we used some of their core technology, built the bots on top of that, and so that it reduces our time to response for our clinicians, and they have all the information that they need when they get started. So in other words, we did lots of partnering in that case. We partnered with an external partner, Informatica, partnered with our internal partners. But again, it all comes down to those goals. What are we trying to do? We're trying to have them operate at the top of their license and be able to be as quick with their responses as possible and make it all very efficient. So it makes it very clear what do you need to do? You lay it out.
Be very clear about goals.
Very clear
First
about
principle.
goals. Exactly, exactly.
Yeah, we particularly you mentioned having clinicians on staff. With a lot of the products that we build, usually these are internal use, meaning they're for our nurses, our doctors, and other staff. Well, that takes a lot of trust from anyone to start using some type of new technology when these are individuals who went to school potentially for quite a while to take care of people. And that's their first goal, is not to use technology. That can be fun, that can be cool, but their goal is to help people. And so we've got to have not only trust from that perspective, but also trust to work on something new. And that's really quite often a challenge that we even have internally when it comes to building new technology to support our care providers, because they simply find it difficult to have the time to do that. Their days, 100% of their time, are dedicated to helping patients. And so we often run into a struggle of, well, how do we engage with them in that kind of exciting, innovative way when innovation is not their job? It's simply not. And so a couple of years ago, I think Mangesh Patil was here earlier, may still be here. He's part of the Care Transformation Innovation team, which when established very intentionally, we identified 4 hospitals throughout HCA that are our innovation sites. And they are specifically set aside to have dedicated time to work with us on these innovative products. Without that, we would not be making the progress that we are, because and I'm sure all of you feel this, you've got your day jobs. And if those are purely in operations, that's what you need to get done because that's what you're graded on. But are there opportunities within any company to carve out time to say this group is dedicated to finding a new way to run their business, to take care of their patients, whatever that may be. And so that has helped significantly when we think about internal partnerships, to have people who have dedicated time to spend with us, and then they become supportive and they want to share what they're doing with us, and it helps grow the excitement within the company as well.
And is there anything that makes that the most critical success of it? How do you get the internal group that's focused on innovation to spend enough time with people whose day job is getting sort of operations, getting patients through? How do you sort of get the time together to innovate together? Because you have to understand the customer problem to come up with the ideas.
That's exactly right. In our case, we tackle a problem at a time, and we have and I won't go through details, but a number of sessions where we focus first on what you said, what is the actual problem? And if it were better, what would some metric be or some measure that would show it is better? So for example, one is around scheduling and staffing, which can sound kind of basic, but it becomes quite hectic and crazy within hospitals. And so we knew if it looked better, we could measure certain ratios to make sure we do have the right number of nurses there at any point in time. And nurses care a lot about that, so they're willing to invest the time. And then we have a series of events that we go through with them to start to figure out how could that be better for you. And only then do we start to talk about how technology could help. But like you said, you always start from the problem. So we're all aligned on what we're trying to solve, and then we can solve it together.
Yeah, I think sometimes it's about listening, right? And listening about the problem, asking about the problem. But I think the other thing that I found, especially in product, just watching people. So I'm a big believer in ethnographic studies, watching our nurses in the command center. I was with them for an hour a couple of weeks ago, and I'm like, there were 5 different issues that I saw with their workflow that if I'd asked them, they would not have detected it, because you just, you learn whatever you learn. And then in that hour, I noted 5, and this wasn't a product session. They were just showing me their work. And I thought, we need to improve that, need to improve that, need to improve that. And then my job is to come back with a solution and then see if we've met their needs, if we did make it better. Because I think the other thing around technology is that in healthcare in particular, there's been some things that have happened in the past that have created more burden for our clinicians. So there's a trust issue, I think, across the board. So we have to come at it with, how can we really truly solve this problem? How can we save you time? How can we make this more efficient? If we come at it that way, and then we actually achieve that, I think that trust, the fact that you brought up trust, is actually built and super, super critical in the partnership relationship.
Sure.
Yeah.
I think also one thing that we have done in Active Health is that we have a single product team. So underneath my organization, it's product. It combines clinical product with technology product. They sit under the same team, under Leah, who's here in the audience. And so that has allowed us to bring together the technology teams with the clinical teams, so they're close together. And I do agree, the idea about bringing the clinicians together, having them just do their work. And we've done a couple of workshops in the past few months where we just said, okay, show us how you do X, show us how you do Y. And I think the thing that earns their trust is not only the listening, but giving them some quick wins. Like, they listened, and then in a week's time, the thing that was like a bothersome nit, we have fixed, so that they have more faith that the things that are going to take a little bit longer to fix, we're actually going to deliver. So I think that that's been, because they really are the last mile for us between us, technology, and the member, and making sure that they're productive and, like you said, operating at the top of their license is key for us. Yeah.
So the last segment, let's talk a little bit about technology partnerships. Obviously, that's come up in a lot of discussion, and you can't really run a business without sort of leveraging technology partnerships to help accelerate your objectives. But what are the places that are most important? Like, where do you try to differentiate with technology partners? Because you hear the aphorism sort of, buy what is commodity and build what's differentiating. But sometimes you need technology to help you differentiate and really accelerate. Where do you think about the technology partnerships as part of your differentiation strategy?
I could start there. I see a few in the room right in front of me. So from an HCA perspective, we've known for a long time that we have a lot of data. We've been told we have the largest combined set of clinical data, at least in the country, but potentially more broadly than that. But we had, for quite some time, we've only used it to really a limited set of value. But we started to see that a lot through COVID, what it could do. And so in 2020, for example, when everything hit, right, in March, and a bunch of us needed to start going home, working from home, the teams that I work with were able to bring to bear real-time data to show across all of our hospitals who had COVID, where might it occur. We began forecasting which markets would occur in. That helped us to leverage the ventilator work that I mentioned to start to distribute ventilators more efficiently. So we're actually able to give some to the national government when they needed it, because we become more efficient. And so what we're able to do with that data gave the broader company an appreciation for what was possible. And so coming out of one of the waves of COVID, where it's always here with us, but we said, all right, as a company, where's our future direction post-COVID? And so the company's leadership had seen this data can do so much for us, but we needed a partner that could really help us to leverage that data much more fully than we'd be able to. We know that we have a lot of patient data that we need to organize and be able to search through efficiently. Who does that? And so we engaged with a number of groups to figure that out, and we chose Google. And I see a few folks in the room here from Google today, because, as you can imagine, trying to put data together and search through that is something they do quite well. And then to have capabilities for AI and machine learning on top of that have really stood out. And so that's been where we've partnered extremely closely, such that they are in the building with us. They build alongside of us. They help us innovate. Then it was time to get to operations. We work with them on that. And so that's been an extremely important partnership for HCA. Now, what's interesting is through that partnership, we develop more. And so we've actually spent the last several days, Pager was there as we met with a lot of Google partners and started to talk about how we work with them. But one example that does stand out that's worked very well, sometimes you have partnerships of 3. And so we also work with a company called Augmetics. We've invested some in them to capture ambient data through conversations with physicians. And we were working with Augmetics to reduce documentation for physicians. We need for them to improve the performance of their algorithms to get to a specific ROI, a metric that we had for success. And Google has the expertise to help them with that. So we spent time, the three of us together, to figure out how we do this, and are really starting to see the benefits of that as well. So, you can start with one very strong partnership, and then it can actually enable others to work more effectively as well.
Yeah, great example. We saw almost exactly the same phenomenon with COVID when I was at CVS. Sort of it made the need to bring the data together faster and usable it just became that much more clear, like why in a crisis that became critically important. Yeah. Other thoughts on technology partnerships?
So one journey that we've been on over the past few years is that we used to have a homegrown care management system called Active Advice. We made a decision to switch to Epic. And one of the reasons that we did that also is from a technology partnership perspective. Epic has a huge share of the market when it comes to EMRs. Working as a population health company, it brought a lot of value as a technology partner. We're then opening up lots of hospital systems that we would be technology partners with based on their network. So for us, what we try to do right now is, and I think I say when you were there, why not Epic? Like as we're looking at new functions or capabilities, if Epic can already do it, I'm already leveraging that platform, why do I think I can build it better myself than leveraging something that's an industry partner? So we're really trying to look at Epic as a way to open up that ecosystem. And I do the same thing with CVS. Like, in terms of CVS, we'll build things that are targeted around interoperability to connect us to HIEs or, using SureScripts or other types of capabilities. I'm not going to build that myself. I'm going to ride the superhighway that either Epic has built or that CVS has built, and then I'm going to focus more on building capabilities that differentiate us for our members as opposed to that underlying infrastructure.
You leverage someone else's development cost. And
Exactly.
interoperability is a key. Interoperability across the ecosystem is critical.
Yeah.
Rita?
I think it's really interesting because you talked about Google. We also have a partnership with Google, and certainly gets you access to this global cloud infrastructure. We also have customers in Latin America and starting to develop more internationally. So certainly having that partnership is very, very important for that. But I think it's important to think about then go to market. Again, I talk about the stage of this company. We have had a lot of success, but with a partnership with Google, for instance, it just gives us more go-to-market access. It gives us access to more of the market. And so it's interesting how you could then bring technology and then go-to-market partnership together. It certainly makes for a richer partnership and it helps, again, reach mutual goals and opening up the market here in the US and abroad as well.
So we have about 5 minutes left. Last question for the group, generative AI. Can't avoid that topic. Same concepts of partnership, just different technology, or has it changed? Is there any way you're thinking differently? A little bit, as much you could share how you think about generative AI, and is it what's the same and what might change a little bit, just given that foundationally new technology?
I think we're being pretty agnostic in terms of the core Gen AI technology. What we use Gen AI for now is really creating personalized patient journeys. But as we think about more things that are on our roadmap, really partnering with our customers, again, because we're not going to use our customers' data to do anything. They have to partner with us. We have to become partners with them around what are their use cases, and then try to generalize that to the market once we create a framework. So that's a lot of how we're thinking about Gen AI and our innovations, and then again, partnerships with our customers to bring that to the market.
So I think, so there's a lot of excitement, right, in the industry. And there was a lot of excitement, like when ChatGPT came out, and like I had my head of clinical operations, and she just was trying to see how she could create a care plan. And she said, it really is pretty dramatic, like what you could do with this. But when it comes to clinical use cases and being part of CVS, like we are very, we want to make sure that we get this right. So we're doing a lot of POCs on it and checking it. One thing though, from Active Health's perspective, and We're very proud. We had the most request for authorization from CVS to do a pilot on certain things. Is we're doubling down on how we build technology. So for us, using some of these capabilities to say, let me start with a use case and go use case to code. Like, how can I do things to automate or more rapidly develop systems that we feel pretty safe on? I think one things we're going to be looking at is how do we have a large language model that is probably internal to our company, because we have enough, similar to you, we have enough data that we could do quite a bit with. So that will probably be. So our first approach is let's test and learn on our own development teams. What can we do to accelerate? And then look at how our clients are requesting use cases and where we could add some that make sense, but being very careful when it comes to clinical recommendations or anything related to that.
Yeah, and we've added, I was just going to say that we added clinician review before it ever sees the light of day into it.
Yeah.
Because it's, I mean, we're there, but we're not all the way there. So, and because we're in healthcare and we're talking about human lives, we have humans in the workflow today.
Which is consistent with virtually everyone we speak to. Like, there's a huge excitement of technology, but no one's really ready to sort of turn that over to sort of it's a human-assisted tool, but not something that's really making decisions that affect patient care.
Yeah, that's right.
Yeah, and back to the internal partnerships we talked about, that's really important with this. Now, there's the excitement, like you said, around the company, but especially in clinical, we have to be very careful. So that's where we've leveraged some of those sites I mentioned to work with some of our physician partners to help build this. So, for example, we've created a framework where we are enabling some of our early users who are helping us do this together, because not just technology folks doing this work, to create the prompts themselves. We actually have an ED physician who added to his LinkedIn profile prompt engineer because he loved the work that he was doing with this. But I can't ask these questions in the right way that he can because he knows his job. So we've created a framework like that to create the trust that we've talked about. And then secondly, in terms of partnerships, we wanted to decide quickly, how are we going to use this responsibly? I'm personally quite bullish about it, considering all the documentation that people have to create in the healthcare industry. I know, I have seen it is helping with that now. We're starting to see some benefits from it, but we need to make sure we're using this wisely, like you're talking about. So we actually partnered with Deloitte in that case, who has developed a responsible AI program to come in and say, okay, where are we at HCA on a spectrum, on a continuum, and now help us establish that. It was more a consulting agreement, but it's put us in a place quicker than we would have to put in place an entire responsible AI framework for the company to make sure that we're using it on only the right use cases. We are excluding some, and we will for a long time. But as also that we're using the correct way and that we're continuing to evaluate, do these models work over time, and that we're being the right stewards of when there is a valuable technology like that.
And are you, I'm sure most organizations are thinking about stewardship or appropriate use. Are you bringing your partners into those discussions now, or sort of that's the next phase?
Yeah, no, we've created an ethics checklist around AI in general. I think it would be amazing to have some kind of standardization on a checklist across the industries, right? I think we're all trying to develop our own, but it would be amazing to have a code of ethics that everyone buys into and does that. And partnership with our customers means buying into our ethics checklist, but I would love to see a standard that develops for the market.
Yep.
Yeah.
Makes total sense.
Yeah.
Well, we are out of time. This has been a phenomenal discussion. Lots of sort of lessons around, listening, spending time with customers, first principles, success metrics. Kathy, you mentioned the ability, I think the internal network is more important than the formal one, like 10 to 1 in some cases.
Yeah.
So
speaking as former partners.
You learn that for a couple of years, you realize it doesn't really matter who someone reports to. If you don't have the relationship, you're not going to get it done. Anyways, thank you all for your participation, sharing the stories about your organizations, really hopefully creating the right dialogue, like how do we keep, as a healthcare ecosystem, work together and partner to deliver better outcomes.
Great.
Thanks, everyone.
Thank you.